Well, the pandemic has disrupted many things, including programs for some vaccinations. Doctors in Ontario worried about the risk for students whose in-school HPV vaccines were cancelled. The CBC's Kimberly Molina tells us there are efforts underway now to make sure those kids will still be protected.
Grade 7 students normally get 2 doses of the HPV vaccine, one in the fall and another in the spring. But when schools shut down across Ontario last spring, most students didn't get their second dose. And now a new group of students are at risk of missing their first. That worries some physicians.
We don't want people to slip through the cracks and find out years later that they were supposed to get a second shot and never got it. They're entitled to it. It's paid for by public health. And we want to protect boys and girls against the various cancers that HPV causes.
The Canadian Cancer Society says 3 in 4 Canadians will be infected with HPV, and most HPV-related cancers happen in other parts of the body outside the cervix. Those cancers can include everything from anal cancer to mouth and throat cancers. And the risk of getting various cancers goes up if someone isn't vaccinated, or if they get vaccinated over the age of 15. Brown says removing in-school vaccinations mean many students will miss the crucial vaccine, putting them at greater risk.
Do we know which students are going to have a family doctor or which students don't? Are they going to come to their family doctor? Is it going to be something their parents are able to do or perhaps not done as easily? Will the doctors have the vaccine?
Ottawa Public Health was offering catch-up clinics throughout the summer to any student who had missed a vaccine, but that program has now been put on hold so it can focus on distributing the flu vaccine. Whether the HPV vaccine is being offered in schools this year depends on the local health unit. Some regions like London have plans to offer the vaccine in school, while others say students need to schedule an appointment with their family doctor or at a community clinic. Kimberly Molina, CBC News, Ottawa.